welcome back to Trigger Point Tuesday. First of all, I want to thank everybody for leaving a few comments on Facebook and a few suggestions on some things you would like to see me address, because it definitely helps out as this goes along to get some ideas, to figure out what it is that you guys really want to see. So this week we're going to cover some more stuff about the ankle. We've talked about it a little bit in the past, but we're going to cover a few more things. And then next week it looks like we'll be talking about some hamstrings, and then we'll see after that. So let's understand first of all how this ankle is supposed to work. Now we have a little bone down here in the foot called the talus. This joint is known as the talocrural joint. So here we have the talus, which is going to look a little bit like my knuckle there. Let's pretend it does. Then we have the tibia and then the fibula. And the way this joint comes together is it sets down like that. And if we've had any kind of chronic ankle instability or repetitive ankle sprains or anything such as that, this can stop working the way it's supposed to. Now, we have a lot of muscles around here that can become dysfunctional, which we will address, but we also have a lot of ligaments around here that helps to stabilize this, and it doesn't hurt to try to get those guys to move around a little bit as well. So to start off with, let's get these muscles to calm down. So if this is like a corrective exercise strategy, our first go on to the soleus here, and I'm going to increase some compression with this other foot. We're using our grid foam roller, by the way, as I'm sure you can see. Now, if you find a tender spot, which you probably will, and I like to rotate my leg in just a bit to search the inside part of the soleus, the first thing I want you to do is to stop and hold pressure. Now, again, this is if it's a corrective exercise strategy. We want to get those muscles to calm down a bit, so we're not going to roll really fast. Once that pain starts to reduce, then we're going to go back and reintroduce that mobility by adding in some small rotations here with the foot. You can do that 4 to 5 times in each direction. And then we're going to do some cross fiber friction. And like we've talked about in the past, what we're doing there is first getting the muscle to calm down with ischemic pressure, and then we're reintroducing that normal motion. So we're going there to the soleus. As soon as we get done with that, we're going to come up here to the Peroneus. So this Peroneus longus, and the same thing, apply some pressure here. Whenever you find a tender spot, stop and hold. Be sure you're breathing. After that pain starts to reduce, again, we're going to add some motion. So here, just a little bit of dorsiflexion. So I'm just bringing the toes closer to the shin, and then plantar flexion. So point the toes out, and we're going to repeat that 4 to 5 times. And again, spend a little bit of time there to get that to relax. As soon as we get through with the peroneals, now we're going to go here to the biceps femoris. Now, it seems like this is a long ways away from the ankle, but it connects right there to the fibula. This bone that sticks out here, this lateral malleolus, that's the fibula. So if this biceps femoris is pulling or doing anything here, it's going to disrupt what's happening there. And it's also going to increase tension in the peroneus. So I'm going to find that biceps femoris is going to feel like a thick guitar string. Going to apply pressure right into it. And then again, apply some more pressure here if you need it with the opposite arm. When you find a tender spot, stop and hold, breathe, get it some time to relax, and then after you feel a slight reduction in pain, you can start to reintroduce that range of motion there. So we're going to relax the soleus, Peroneus longus specifically, and then the biceps femoris. After that, we're going to do a few low-grade joint mobilization techniques. So this is all self-application. So what I'm going to begin with is taking this distal tibiofibular joint here, and I'm going to apply an anterior to posterior force, and this is just going to try to reintroduce some of that motion. So somebody asked about the talofibular ligament. They've been feeling some pain there. So if we think about what it does, makes up part of that joint capsule, we need to apply a little bit of pressure there and get this to mobilize backwards. So the way I suggest you do that, again on the grid foam roller, we're going to take, hopefully you can see this okay, I'm going to apply here, like I said, anterior to posterior force, so my hand's going to go here on my calcaneus. I'm going to apply a little bit of pressure forward, and then I'm going to try to dorsiflex again. And being a joint mobilization technique, it's going to be very low grade, and we're going to repeat this 5, 6, 7 times. Be sure you're breathing and applying that pressure there, and spend some time on it. As soon as we get done with that, now we're going to come right here to the proximal tibiofibular joint. We're going to do just the opposite. So whenever we go through dorsiflexion here, this needs to go backwards, this needs to go forwards. So we just did anterior to posterior, so here we're doing posterior to anterior. So again, I'm going to put the fibular head right on the grid foam roller, not a whole lot of pressure, and here I'm going to try to pull backwards. So I'm just trying to mobilize very gingerly to get that to move the right way. Now, as soon as we're done with that, we've got those muscles calmed down, we've added a little bit of motion there into the joints. Now we have a couple of different ways to stretch. One very common way is to, and I'm going to do the side that I've not rolled, we're going to take and apply a posterior distraction here with our band, and this is a great stretch. I love this. So we're going to take this forward, the knee goes forward, try to keep the heel on the ground. One of the things I like to add into this is to get this knee here to move. So really what I'm doing is flattening the arch, and then I'm raising the arch. Flattening the arch and raising the arch. And what I want you to think of, here's that joint. You're just sort of massaging in between of that, in between that tibia and fibula. Just trying to, again, get that motion there, get a little bit more mobility. One of the things about this stretch, though, and this is what may make it not work for everyone, is whenever we apply pressure down, we're compressing that joint together. And there's a reason why it compresses. It's so we're more stable as we walk or run. So a lot of times, this doesn't work for everyone. So if you're the person where you're just not really feeling that this is getting you more range of motion, I want you to try something a little bit different. So what I've done is I've taken my band and I've cut a slit in it right there. I'm going to take my foot, slide it in between. So there it's on the top and it's on the bottom. And now I'm actually going to distract the joint. So I'm going to take the grid foam roller right back here, apply pressure back. So now as you can see, I'm distracting that joint, which is going to make it move much easier. As soon as I get that distraction here, take whatever kind of strap you have, and here I'm going to do just some contract and relax type of stretches. So again, I'm distracting, pull this to my first point of tension, and then I'm going to plantar flex or contract the calves to push down. I'm going to hold that for 7, 6, 5, 4, 3, 2, 1, and now I'm going to apply pressure back up towards me. You can see I'm increasing dorsiflexion, activating my anterior tibialis, and then I'm going to hold this new range of motion for at least 20 seconds, maybe 20 to 30, and then you can repeat. Apply pressure back down again for 7, and then you can relax. So again, that's a different way to try to increase range of motion there to the ankle. And remember, once you get that new range of motion, you have to show your nervous system that you have it. So as soon as you're done with that, whenever you stand up, integrate in some balance exercises, even if it's just standing on one leg like we've done in the past, maybe some lunges, or maybe just some basic squats. Something to take your body through this newfound range of motion, so that way it can start to utilize it a little bit better. So there we go, a little bit different way to mobilize the ankle. Give it a shot, let me know if it works for you. And again, keep posting some more requests on Facebook. Other than hairstyle, that's perfectly fine. Anything other than that, I'd be happy to try to answer. Thank you again, and we'll see you next week for Trigger Point Tuesday.